Hi, today I'm going to talk about the different ways that you can experience your membranes rupturing. Thanks to Hollywood's need for drama, we often have a skewed idea of how labor begins. You know, like how the pregnant character is walking along, suddenly stops, doubles over, grabs her belly and screams, "Oh, my water just broke!" And then 2 minutes later, she's in rip-roaring labor with contractions coming every minute and yelling that she needs to go to the hospital. Let me tell you, that is so unrealistic. 90% of the time, contractions begin first and then the amniotic sac releases. The other 10% of cases that have the bag break first are experiencing what is called premature rupture of membranes, or PROM for short. Here in Calgary, most doctors and midwives would like you to come in and get checked to confirm if the bag actually ruptured and to check on baby in case of cord prolapse, which is very dangerous. Since you could experience the bag breaking as either a large gush, usually after a sort of popping sensation, or it could come as a slow pinhole leak that can be confused with watery vaginal discharge, semen, or even leaking urine. Yes, that really does happen. A quick test at the hospital involving drop of amniotic fluid on a piece of special paper can usually ascertain if it is indeed amniotic fluid. If you have experienced premature rupture of membranes, usually you're sent home on your way to wait for labor to begin on its own. Ideally, labor should start within 24 hours as the risk of infection to the baby and uterus increases as time goes on. Some care providers are not comfortable waiting the full 24 hours and suggest induction after only 12 hours. It's up to you to weigh the benefits and risks of induction or carrying on and decide how you wish to proceed. Some factors like being GBS positive will increase your risk factors. As already mentioned, the most common way the bag breaks is once contractions have already started. This is called spontaneous rupture of membranes. Some women even manage to make it all the way through active labor without the bag releasing. Usually once you start pushing, it will break with the added pressure. In very rare cases, babies can be born with the bag completely intact, which is referred to being born on call. Sometimes care providers ask to break the bag, a process called artificial rupture of membranes. It is done by inserting a long tool that looks like a crochet hook through the cervix, and they tear a small hole in the bag. They might suggest this as a way to either start or speed up labor. Studies do not support this method of induction or any shortening of labor lengths when it's done. However, many care providers still swear by it, and I have personally witnessed a marked increase in contraction strength when it is done. Again, please weigh the benefits and risks for yourself before deciding on a course of action. The main risks include increasing infection and cord prolapse. That's when the umbilical cord comes down into the vagina before the baby does. You may decide you would rather try some natural induction or augmentation methods, or you may consider a Foley induction or perhaps using synthetic oxytocin. Artificial rupture of membranes needs to be done if internal monitoring is desired, either to monitor the baby's heart rate or the strength of your contractions. Sometimes care providers will also ask to rupture the bag if it is still intact when you start pushing, as they don't want it to burst while they are waiting to catch the baby. If your water breaks while at home, be sure to note the time, the color, and if there is any odor to it. Your caregiver will need to know these factors before a recommended course of action can be provided. To keep the risk of infection low, you should not put anything into the vagina. That means sex and tampons are a big no. Again, you may be asked to come in and have the baby and fluid checked before being sent home for labor to progress. Or if there's significant cervical dilation, contractions less than 5 minutes apart, or you have other risk factors such as being GBS positive, you may be admitted. So, while it may seem unlikely that your membranes rupture at home, it would be wise to protect your mattress in your later weeks of pregnancy with a waterproof pad or sheet. And if you're completely paranoid about it rupturing in public, give yourself some peace of mind and throw a maxi pad in your underwear when you're out. Nobody wants to be the cause of an intercom call out like, wet cleanup on aisle 9.